So as it relates to this pandemic, you called it for me long before the world called it. You were close to it. Your brother was in New Rochelle, part of the initial quarantine. And you were calling me and you said, this is going to be a lot worse than people think it is. This is going to be horrible. And I remember telling my team that I think we're going to be out of the office a little longer than a week or two. And so I thank you for telling us that ahead of time. But what are you really seeing? I mean, I think what people are logging in to hear about is what's really happening behind the scenes. What is it like to be part of the hospital today? And what are the things that you're watching for and worried about?
So this is how it works. So I guess you can call it on the front lines. It sounds very militaristic, which it kind of is. It's just a little different. There's an invisible enemy as opposed to a real live enemy that you can see. But we are told we have meetings bi-weekly from our chairman, from the people that are running this kind of disaster type scenario. And they give us an update. They tell us how many people are coming, how many people are in the hospital, how many people require a ventilator, how many people have gotten off the ventilator, and of course, how many people are have died. So we are updated every day. We also get updates on, the availability of our PPE or our protective gear. That's becoming a little bit of a concern. And they tell us what it's going to be like for the next week or the next 2 weeks, and maybe sometimes in a month or a year. But that's what we're dealing with right now, and that's what we're learning day to day.
Right. And where are we in the curve? I think that's what we all hear about in the news every day is the curve. And where are we in that?
So that's a really good question. So curves are everywhere. You could have a curve in your neighborhood. You could have a curve in a hospital, in a state, in a country. Our country is so vast and so different culturally and everything, and equipment and expertise. You have rural hospitals, you have city hospitals, and how they manage and their ability to garner lots of equipment and personnel varies greatly. I can't speak to any other region. I feel like some regions are escalating their number of cases for various reasons. I feel like our hospital is going to see the worst of it in the coming week, maybe the next 2 weeks, which means that the number of people that will come in will overwhelm our system to some degree. And we do have the concern that we will run out of adequate care in the form of ventilators and staff to manage those ventilators.
Joan, when you talk about overwhelming the system, again, I'm trying to think of the words that I'm hearing again on the news. What does that actually mean, overwhelming the system?
So that means that actually, technically, there isn't a way to keep a patient alive who needs to be put on a ventilator. Like the simple fact that there just could not be a ventilator available, and that's a tragedy. It could happen to a young person who really needs it, and they would have to be told there is no ventilator, as simple as that. Or other things like drug shortages. To keep the people asleep, we need massive amounts of intravenous anesthetics. Those are things that keep people asleep. Those are at risk of running out as well.
So actually, maybe we jump a little bit to when people are sick. I have known people that have been sick and they've been put into comas. Is that what you're referencing? That when you keep people asleep, or just tell me if I asked the wrong question.
Coma always has a connotation of scary movie or something that didn't go right. But in order to tolerate being on a ventilator, you need to be asleep. So we put these people to sleep to tolerate being having air blown into their lungs. Yes.
Wow. So what does it, again, we've heard all sorts of different aspects of being sick. We hear about the people who are asymptomatic. We hear about the people who have died and everything in between. Again, if you watch television, Chris Cuomo is sick and he's telling horror stories.
Yes.
But he's not in a hospital sick. So can you give us an idea, what does it actually mean to be sick?
So what it means to be sick is just like you said, there's a huge variability. And you can watch the news, and what we're seeing is, of course, the most dreadful stories, because nobody really is publishing the good stories, but there are a lot of them. There are people who are getting mild symptoms. That just means maybe some flu-like symptoms. It's very similar to the flu. If you were to get a moderate illness, meaning you have a cough, you'll have a fever, you could have some aches. if it progresses from there, maybe 5 to 10% of the people might need hospitalization, and that would require some oxygen in order to help the lungs tolerate the virus in the lungs. But you're right, it's variable, and a lot of people are getting better. We just don't know who's getting better, who's getting sick, and who's going to be really, really sick. Obviously, if you have underlying medical problems, high blood pressure, diabetes, moderate to severe obesity, and underlying lung conditions, it's going to be much harder to recover.
For the people who have been sick, they're on the very sick, right? It really does a number on your lungs, and it also could attack your heart. So what does that look like?
So there isn't the heart issue is interesting. I feel like it does progress quickly, and whether or not it's a question of invading the lungs or the heart, or just an overload to the heart, because when the lungs fail, the heart fails with it on occasion. And that's probably why we're seeing patients die from heart problems, is that their heart just can't handle what the lungs are going through. And yeah, it can be severe and quickly fatal.
Okay. And what happens to the lungs during this? I mean, I know that people talk about getting a pneumonia. I've heard things about, and again, I'm not a medical person, the fibers being ruined, the lungs filling with fluid.
The lungs look like there's certain patterns that you can look like a CT scan would identify sort of a characteristic pattern of this type of pneumonia. It can go to one or both lungs. I've seen it attack both lungs. And a CT scan shows the sort of characteristic findings, if you will, of this type of pneumonia. It does have a predilection for the lungs because it is a type of respiratory virus.
Sure. Okay. So is it not attacking the heart then? The heart is then stressed by the effect on the lungs?
Well, that's what I've been led to understand. Like a Coxsackie virus, a different type of virus, goes in directly to the heart. This seems to be more of an indirect effect, although I don't know that it is not attacking the heart specifically, but I think it is an indirect effect of severe stress on the lungs and giving that over to the heart. The heart can't handle it.
Sure. You know, some of the Cheryl, who has been a very loyal follower of ours the past couple weeks, just asked the question about why doesn't the media focus more on the recovery and good stories? I think some of the good stories I have been seeing is the outpouring of donations and things that people have been trying to do to help support healthcare workers. What's it like again? So let's talk about when you're going to work and you know, it is stressful or you've got a lot happening. What's it feel like to be on right now? I mean,
right. So that's I can let you in a little on that. When we first started, of course, I felt like I was the one to go in and the sentinel cases, if you will, the first case in obstetrics that I thought they would be. I was surprised. I thought a lot of pregnant women would just be so nervous. They would just lock themselves in their houses. But, you know, they have children and people go out. And initially in February, at the end of February, when they didn't know this was coming, pregnant women got infected just like everybody else. And when I did the first case of a woman who was very sick from this, she did well. She was very, very sick, but she did recover. And that's a testament to her age and being healthy. But yeah, as I sat there, I was, of course, very nervous about my own health. But we learned how to put on our protective gear in such a way that we're more comfortable with it. When we go in, we put on powered respirators. You may have seen them in the news and on television, where a battery operates it, and you feel more comfortable. So now I'm feeling much more comfortable when I go into work. And it's awful because you have to clean every surface. You can never be too careful, but you learn how to do it.
You know, I'd said, you know, talk to me about the sacrifice that people are making. I think of you not being able to visit your mom right now in assisted living, not being around other people. And you said, no, this is your job. So again, how do you think people are feeling? Like, you know, I've got to believe it's stressful to be at work and have so much happening and then to have to come home, and for people who have children or
absolutely. Yeah. So I think, and if you look at hospitals in New York, it's a little horrifying. I think they were kind of inundated, if you will, with patients, they perhaps homeless. I'm not sure there, but there is an unbelievable number of overwhelming cases coming in with COVID-19 that that I can only imagine, and that they feel like they have to ration all their supplies to such a degree that we don't have here in our hospital yet. We are very fortunate that we've had administration that was very sensitive to that. And so far we are reusing our masks, but not to the degree that we feel like we're putting ourselves at risk. So, my heart and my hat is off to New Yorkers and the people working there. It's a whole different ball game. I mean, they have 160,000 cases, more than most countries combined. That it's just unbelievable. Now, that said, we are heading into our worst week, so we will know more next week how bad it will be. But the fact that a lot of Bostonians have kept inside has really saved a lot of lives.
And how long, in your professional opinion, this is the big question, right? How long should we do this? I do worry that the second that we start to crest the top here, people will say, oh, I can start to go out. Or,
Right.
I did hear about plenty of people who did go see family for Easter. So
yeah, it's a matter of judgment. And I do look around, maybe we're overprotective, maybe we're not, but I go out, I need to get, motor oil or vegetables or something like that. And I do see that there are definitely degrees of protectiveness. Some people are not wearing a mask and some people are having you stand 6 feet away. So I do feel that if we start to let the trickle of people out again, I think it's too soon. Perhaps in a couple weeks we'll know more, but certain people will have to go back to work. Otherwise, as the Federal Reserve has said, that we'll have economic collapse. And that is something that we need to weigh this whole thing against.
one of our viewers, Kim, she said she's been reading that placing patients on vents can be doing more harm than good, and if they can, in fact, be killing patients. Thoughts on that?
So that's a really good question. Once again, the people that are chronically day-to-day are gathering data about this. It's kind of the cause and effect. And, sometimes you have to go on a vent regardless. You tire out, and the data is kind of going back and forth. Initially, the data out of China said, be careful, don't put people on the ventilators. It's causing more harm. But how do we really know that? We won't know until a lot of patients have come through. So we do a procedure called proning, even when patients are not intubated, meaning we put you on your stomach, we put you on your back, and when you have oxygen, with or without the ventilator, we're doing this, and we're seeing some benefit to this. So it's interesting. So you can lie on your stomach with a little bit of oxygen. You're going to do a lot better than if you just stay on your back. And then and it may delay intubation, but intubation itself, when you have to intubate someone, it's
Right.
not something that you can negotiate.
Right. Another good question came up, and you and I talked a lot about this, is testing for the antibody. And, one thing I know is that I know a lot of people who've said, I think I had it.
Yes.
think I'm asymptomatic, right? So how do we know? How would we really know? And where are we with that?
So that all depends on the, sort of the makeup of this virus. When will we know? When, all viruses will have a marker that says, I was in your body. But when do we catch it? Can we catch it for 10 days and then we don't? Can we catch it for a year? It's very difficult to know those things. But presumably, if you've had the disease and if you're checking a week later, that you will have shown to have had it. That is the presumption. So we will be doing these tests pretty soon to see who's had it. And our department is really looking forward to knowing who in our department actually had it and didn't know. It's very unlikely that you had it and didn't know, but there are people out there who didn't notice. And those are very fascinating cases as well.
Well, I know people too that have been home and they have all of the symptoms of it, and they've been sick, fever, and such, but didn't go get tested because
they were turned away, probably.
Right. Well, no, they thought they might be, or they just thought, I'm battling this, I'm not going to go in. But now they feel that they're good. So, again, is that those people should be tested is what you're saying.
That's the big question. When can I go back to work, even knowing that I had it? That's a huge question. And, it's not like the flu, which I actually had this year, and I called up, occupational health, which is the go-to place. You have to call your local occupational health center to find out. And what are they saying? Well, they're saying that if, for our hospital, they're saying if you don't have symptoms, you're going to put on a mask and you're going to go back to work. We need you to work. And we know you're going to be careful. That doesn't mean that you're not necessarily 100% not infectious. Now, for other people to say they've had it and they go out in the public with no mask is a different situation.
Mm-hmm.
I would say that as 2 weeks have gone by, since the beginning of your symptoms, you're probably okay to go out, but I would still be cautious. We're cautious until we find out more about this virus.
And really, they didn't have the virus. They can't assume they had it unless they had a test and they tested positive, right?
That's true, because a lot of people are confusing it with, we're getting at the tail end of the flu season, so it could truly be the flu, although it's unlikely at this point. Or fevers just from, allergies. It's allergy season. And you could have that or many other reasons to have a fever if you have an infection from something else as well. So it is confusing. But if you have the typical dry cough, you have fevers, you don't feel well, it's likely that you got it somewhere. But if you've been completely, they're still getting cases from people, in delivery scenarios from supermarkets. So we aren't entirely 100% closed off like we think we are. So there are still ways to catch it if we're not 100% careful.
I want to encourage people with 6 minutes to go that if you have questions to please ask. I think another interesting thing, several of us have been talking about our allergies, just being home all of the time instead of out, right? I'm allergic to my dogs, but I'm not with them all day, every day. So now that I'm home, my asthma's been up more and I've been sneezing like crazy. So thank God sneezing isn't something we're looking at for corona, because
sneezing is okay. Yeah, sneezing is okay.
But again, we're in very different environments than we normally are. And so I think that's another piece of how we're feeling, not to mention stress and anxiety all adds to things. Trying to think of other things. Other questions, again, the burden on the hospital, right? Do you think that, is Beth Israel not overburdened? Obviously you did great planning. Obviously people in this area have done a good job of staying in. Do you think that speaks to all the hospitals in this area? Or, and I know you can't speak for other hospitals or other regions, but.
I'll give you a small example. Nantucket is, I can see it from here almost, maybe not quite, but I am on the Cape and I'm close. So I read.
You're on the Cape right now at your Cape house. So
I am. Yes. Just until tonight, then I got to go back to work in Boston, but they did a smart thing. They put everyone in shelter. They said, look, I know everyone wants to come here from New York, but that's going to overwhelm our system instantaneously. And sure enough, they did have one death there, but only 10 cases. So if we could, all of us do that, not go anywhere for a couple weeks, you'll see a massive drop off in the number of cases for sure. And they've saved themselves by not allowing people to do business as usual down there.
Right. So does that mean that May 4th might be a realistic time frame? And again,
May 4th is a great day because that's my birthday. So is that realistic? I'm looking at my calendar right now. It is May 4th is actually could be realistic. I don't know. It will depend on city by city, right? Maybe for Nantucket it will work. Maybe for the Martha's Vineyard it will work. Maybe not so much for Boston or the county of Barnstable, because it all depends on the resources that we have and what we're seeing. If the resources, they say, look, we have a lot more resources, we're going to let people go back to work. We are. Yeah.
So people have to realize that there's risks. This isn't just like we're all jumping back in and, the pipe will be full right out of the gate. It's a slow comeback, right?
Sure. And people who work in close quarters, that's obviously more risky. It's such a contagious type of virus that we wouldn't want to put people back in a scenario where they just came from and have the whole thing start all over again on a lesser level. We need to get that herd immunity, as it's called. We need to get a vaccine. This is going to be the key thing. And we're working on it. Actually, the Beth Israel, they got $1 billion from the government at the Beth Israel. Dan Baruch, he got that for working on a vaccine because he has the capability to ramp up in the case that he does get it. We need to ramp up quickly. We need to have millions and millions of vaccines ready to go, not a few thousand, but only a few people know how to do that. And presumably they're able to do that at the Beth Israel.
Right. Well, can you just tell people who Dan Baruch is? Because for the rest of us, you had to tell me who he was.
He's a virologist researcher working at the Beth Israel currently and has been involved in the past with other viruses. I believe with the past
He's
SARS
world renowned.
virus.
He's world renowned.
Yeah, he's world renowned, and he does have the capability. He was working on an HIV vaccine. I think that's something that was really exciting that he is working on, put on hold, of course, but this absolutely needs to be done in order for humanity to continue the way it had for so long.
Well, and I'm going to jump to that in 1 second. You know, every day we do a poll, and the poll every day has been, how are you managing working from home? And it's been interesting because it's been trending that people are starting to like working from home. Today, I love it. I hope I can work from home forever is going back and forth between 45 and 50% right now. That's on the very high side of what we've been seeing. And last week, the highest it's been seeing. I think people are starting to get used to this. It's working pretty well for now. It's at 33% today. And I can't wait to get back to the office. It's at 25% today. So I think it's interesting how that's starting to, people are getting used to it. You know, a good question somebody asked was, how will this pandemic change hospitals' readiness and preparedness for programs moving forward?
That's a really good question. That's an outstanding question. And if you look at, there was a video that was put out, I think Bill Gates, I think I can find it for you, Lisa, but they were worried about this with the last pandemic. They were worried that we weren't prepared. I think Bill Gates himself specifically said, look, we are not prepared as a nation. We're not prepared as a world. We're not prepared locally. What are people doing about it? I don't think it really hit the mainstream media. And now, of course, it will. And we're going to go back and see what recommendations they had then. There's some things you simply can't prepare for. And I don't know yet, but I think this will absolutely give us some data to go forward and to be better at this. Well, I'm amazed at how well we're doing already, even though it doesn't look good. The numbers are grim. The fact that people are sort of standing together, caring for one another, caring about one another, I think makes a huge difference. And ultimately, regardless of the scenario, that's what will pull us forward. And it sounds trite, but that's the truth, is that we have so many people working on this. And it's just a maneuvering of resources from A to B. And if Louisiana should need some, hopefully we'll be done with our curve and we can lend the South some of our ventilators and so on. I think there is going to be some administrative, if you will, data on this. And going forward, what can we do in the next time that this happens? Because presumably it will happen again.
And I think that that's something that everybody will be better prepared for. I know that already buildings and infrastructure is thinking about this. So I'll leave you with this because we try and keep it right to 25 minutes. Part of the reason that we're doing as well as we are is because people are adhering to the recommendations and staying in. I know that from the government, they're saying that people have adhered to this much better than they could have expected and hoped. And that is why we're starting to move through this. But the fact is, if we don't maintain caution, if we don't keep our foot on the gas of caution, this could surge back again. Is that right? And that
is true at the moment. Absolutely true at the moment. And we have cities that haven't gotten even close to the peak yet. They don't know what they're dealing with, and that's going to come. But the fact that we all sheltered sort of for the last few weeks has made a humongous difference. If we let everybody out, it would be just a humanitarian disaster of unbelievable proportions. So I think we've done a good job considering, given the circumstance. But if we let ourselves run around now, it would be a problem for the local hospitals.
Okay. Well, I really appreciate you taking time to talk to us. I know how busy you are back and forth, and we appreciate everything that you've been doing and all of your colleagues. I want to remind people that 100% of the proceeds from the Wicked Dog shirts, Stay Safe, Stay Wicked, go to the Beth Israel Healthcare Heroes Fund. And Joan, thank you so much for joining us. And
thank you for putting this together on such short notice. And it's been a pleasure.
All right. Thanks, everyone. Have a great day. We'll see you tomorrow.